Welcome to our webinar series, Save 600 Hours in 6 Figures this year with ULab. I'm Dr. Jeremy Manuele, and I have been utilizing ULab clear aligners for about 5 years. I was one of their beta testers, and I practice out here in Las Vegas, Nevada. And over the years, I've fundamentally changed the way that I treat with clear aligners, not only from the way that I utilize the software, but also there's been a paradigm shift within my practice on my workflow and also the results that I expect to achieve with my clear aligner system. And I'm going to go through this with you in detail on this webinar series. So we are going to be looking at a lot of different things. So one of the things is the concept of aligners at your fingertips. Utilizing ULab, I'm able to look at a case and establish treatment goals. And it's no longer a decision of, am I going to do braces? Am I going to do aligners? It depends on what goals we have. Oftentimes, it's both. And we'll utilize whatever treatment modality is strongest for the specific movements and patient expectations that we have. And many times that results in clear aligners on one arch, braces on the other, braces on this part of the arch, or other auxiliaries combined with my aligners. With per aligner pricing, I literally have the ability to use aligners on any case that I want in any way that I want without having a huge negative impact on my practice's cash flow in order to do so. And so we're going to go through lots of cases together, the beginning, the middle, the end, what went right, what went wrong. We're also going to be talking about the specifics about how we set those cases up, what that looks like within the software, and most importantly, how you can best as a doctor utilize your time in order to make your efforts the most effective possible, and how to not spend your time on doing things that can be delegated and probably done better by team members anyway. We're going to go through some easy cases, moderate cases, even some difficult cases. And most of these cases, we are going to look specifically at the profitability. Insert your case fee, insert the number of appointments, which I'm going to give you for these cases, what went down, how that happened, and you're going to be able to find out in real time what impact that might have on your practice. In addition to clear aligner cases, we are going to be looking at the cases where we utilized other treatment modalities in order to achieve the best result, or in order to reduce our treatment times down to the most efficient possible. We're going to look at auxiliaries that are used. Along the way, I'm going to share with you all of the specifics that I can as far as giving you what you'll need so that if you want to incorporate these things in your practice tomorrow, hopefully you'll have everything that you need in order to do so. We're going to look at the details. How do these cases get set up? How do these ideas come together in order to create the new workflow, which hopefully will be able to save you as much time and money as it has me. We're also going to talk about some of the unexpected benefits of branding yourself as a practice and branding your treatment and your results instead of branding some other company's name, and what differences that can have not only within your practice from a number standpoint, but also within your culture as a team and as a community. We're going to go through some things that you'll need to know, basic fundamental knowledge of UDesign software. In order to utilize and do these things that I'm talking about, you have to know how to use the software, specifically the parts of the software that you as a doctor are going to spend your most of your time in. We're also going to go through fundamental aligner mechanics. And although we can't cover all of the aligner mechanics in one webinar series, we're going to go through as many as we can in order to give you the most potent information to be able to take home and use with whatever aligner system that you're working with. We're also going to introduce this paradigm shift in workflow, and we're going to show you exactly how it works. We're going to talk to you about Quick 3. What is it? How do you set it up? Who sets it up? How does it benefit the patient? And how does it benefit your practice, both from a workflow and also from a case acceptance standpoint? We're going to talk about keyframes, what they are, how they work, what that means as far as the ability as a doctor to be able to customize your treatment plans that work in favor of your specific mechanics and treatment goals. We're going to talk about chairside refinements. This was an entirely new concept to me before we started utilizing the software in this way approximately a year and a half ago, and I'm going to show you how we do it and how it saves more doctor time specifically than any other change that I've made in the last 10 years of practice. We'll go through the aligner mechanics rule by rule. Again, we'll look at as many as we can in a short amount of time as possible. And I'll introduce you to a concept that's called UDesign preset. So essentially, rather than having to go back and forth with the technician and try to explain to them in a 3D world what's happening by using 2D means, filling out a form, an online form, clicking all the boxes, trying to type in specifically what you want, filling out your clinical preferences. That's all fine and dandy, but that is a very difficult way to communicate specifically what you want when you're working within a 3D platform like Teeth and Smiles are. So rather than doing it that way, what I do is I take 2 to 3 minutes, and that's no exaggeration. I'm going to show you specifically on easy cases, moderate cases, hard cases, 2 to 3 minutes going into the software and setting up the important parts of the case, what I call the doctor stuff, making sure that the amount of expansion is appropriate, making sure that the arch form is appropriate, making sure that the vertical correction happens the way that I want it on the maxillary versus the mandible. How much correction do I want with either? What I'm not worried about is all of the fine-tuning details. I'm not worried about the specific tips, torics, rotations, the specific collision that might have happened here or there. I'm not worried about the attachments and where those need to be placed. I'm going to go in and set up the foundation of the case. I'm going to pour the concrete slab, and I'm going to utilize team members and or UAssist to take care of the rest, and I'm going to show you exactly how we do it. I'm also going to go through how to get organized. Utilizing a completely digital workflow, there's a lot of pieces at play, not only with ULab, but with other digital systems that you may not be using or that you might be using. We utilize a number of different digital workflows in addition to ULab, and in order to keep that organized and have that be done in a manner that does not disrupt your practice or your life personally, there has to be systems, and we'll go through those in detail how we do that. Any resources that we have that will help with that, feel free to utilize, reach out. We can send you digital copies. You can screenshot it. Anything that's helpful, I would more than welcome you to use in your practice to help make it better. And we'll also go through some tips and tricks along the way of some unexpected changes and things that have just been really, really awesome in the practice as far as utilizing Pontics in not only our aligner cases, but in other cases and in situations that you just weren't able to do in the past. And we'll also look at the end at just some few mixed dentition cases, and we'll talk a little bit just for a minute about airway. And this is something that I'm passionate about, and I realize that there's docs out there that are on all sides of the fence as it relates to airway. But I'm going to show you just a couple cases and how that's impacted my practice, and specifically, and more importantly, how it's impacted the lives of some of the patients that we've been able to help. And in the end, we're going to go back to how this all adds up and give you some concrete numbers and estimates as far as what you can expect to utilize a workflow like that. So thank you for joining us. I hope to see you guys soon, and I guess we'll see you there.